Measure and record respirations. Introduction. Respiration is the process of breathing. One complete cycle, one breath in and out, is considered a respiration. You will be counting how many times the patient breathes for one whole minute. A normal respiration count is 12 to 20 breaths per minute. Remember that one whole cycle, a breath in and a breath out, counts as one respiration. Breathing should be easy, quiet, and even. Any patient breathing less than 12 times a minute or more than 20 times a minute needs to be reported to the nurse. Patients that seem to have trouble breathing or have noisy breathing should be reported to the nurse immediately. Do not let the patient know that you are counting their respirations. Patients will unconsciously hold their breath or breathe faster when they know you are watching their breathing. Instead, tell the patient that you are taking their vital signs, and the task takes about a minute to complete. This will ensure that they remain quiet while you are counting and will result in an accurate reading. Placing a light object like an alcohol swab packet onto a patient's stomach when they are lying down will help you notice the respirations more easily. The RN evaluator will also count the patient's respirations while you are performing this skill. This is how the state will evaluate your accuracy. You can be off by 2 breaths per minute on respirations from the evaluator's readings and still be considered accurate. The patient should not be told that their respirations are being counted, as this will cause them to alter their breathing. You should also not stand beside the bed and quietly stare at a patient, because that will make them uncomfortable. Instead, hold their wrist lightly, like you are taking their pulse, but count their respirations instead. The patient will think you are taking their pulse and will remain quiet and will not alter their breathing. To perform this procedure, hold the patient's wrist so you are not making the patient uncomfortable, and pick a starting point on the clock. Say start so the evaluator knows when to start counting. Count the respirations for 1 full minute and tell the evaluator stop when you are done counting at the end of the minute. When you have completed counting the respirations for 1 full minute, perform your closing. Open the privacy curtain, give the patient the call light, make sure he is comfortable, wash your hands, and document. This is a documentation skill, so you will need to write down your findings on the documentation sheet the evaluator will give you. Documentation should always be done after your final hand washing to avoid contaminating your pen. You will document the amount of times the patient breathed in and out in the section marked Record Respirations. Respirations are recorded as a measurement per minute. In this example, the respirations were 18 breaths per minute. Watch the following instructional video on how to perform this skill and the demonstration video that demonstrates this skill in a testing environment. Once you're comfortable, try this skill on your own. Practice this skill often to perfect your technique. Learning to notice the small motions of breathing takes practice.